So Amanda briefly talked about kind of the basic information that we need to have a diagnosis of AML. However, as we learn more and more about the biology of AML, we know that there is additional information that is critical for us to choose the optimal treatment pathways for our patients. Yehuda, can you talk about the additional testing? You mentioned the cytogenetics, any mutational analyses that you routinely run at your institution to get the entire picture for that patient to then be able to treat them optimally.
Because of the importance of cytogenetic and molecular results in the diagnosis, treatment, and outcomes in AML, it is really important that we have these results and some of these results before starting treatment. And so these cytogenetic and molecular tests are usually collected with the bone marrow biopsy and aspiration. Sometimes if there is no aspiration or if we're unable to repeat a bone marrow biopsy or get those results, sometimes we're able to do this through the peripheral blood. The tests that we need to do are cytogenetic analysis, which includes chromosome analysis or karyotype, FISH testing, as well as molecular testing either with NGS, next generation sequencing, or PCR. There are panels that can be performed that include an AML type of FISH panel or MDS FISH panel. And in terms of molecular testing, there also are single mutations that can be looked for or a full panel, a full myeloid panel. We typically collect these specimens. In terms of the molecular testing, it's really important to have testing for those mutations that are prognostic, that are predictive, that are biomarkers, and that can be targeted. So these include, but they're really not limited to, FLT3 mutations, including the ITD and TKD, IDH1 and IDH2 mutations, TP53, ASXL1, RUNX1, as well as many other mutations.
Yehuda, you mentioned that there's obviously a wide variety of tests and we want to collect as much information as we can prior to treating. Can you give us a little insight into the turnaround time for these different labs and how long potentially the picture could take to come together?
With patients with AML, typically patients are quite ill and they often need to start chemotherapy treatment pretty quickly. However, we know the importance of these cytogenetic and molecular tests. So we often do wait for some of these results before deciding on treatment. At some institutions, there can be a quicker turnaround time. However, some of these tests, including myeloid NGS panels, can take a week or even longer. However, the tests that can be expedited typically are FISH analysis, which can help determine if patients have core binding factor leukemia, including APL, which is treated completely differently, as well as FLT3 PCR testing, which can be done quickly with probably a turnaround time with about 48 to 72 hours.
You also mentioned that when you're sending your FISH analysis that you can conduct different panels based on focusing for more abnormalities that may be either AML or MDS focused. Is that something that you're going to take the patient's age into consideration before you order these type of tests?
So yes, we always take into account patients' age and their comorbidities, especially for the older patients who may have more comorbidities, who may not tolerate intensive induction chemotherapy. We really, and also have an increased risk of having an antecedent bone marrow disorder such as myelodysplastic syndrome. So those for sure are the patients that we would definitely want to try and expedite some of their cytogenetic and molecular testing to check to see if they have any MDS-related type of changes.